Hello everyone, today we are going to talk about asbestosis. Asbestosis is a chronic lung disease caused by breathing in asbestos fibers. The prolonged exposure to asbestos fibers causes long-term inflammation and scarring of the lungs, thus making the lungs stiff. And as asbestosis progresses, the lungs becomes more and more scarred and thus become more and more stiff, making it difficult to breathe. Thus we call it restrictive lung disease. The symptoms of asbestosis appear starting from 20 to 40 years after initial exposure. In your lungs, the main airways are called the bronchi, and then they branch off into smaller airways called bronchioles, and then they connect with the air sacs called alveoli. So what happens when you inhale asbestos? The alveolar macrophages in your lungs tries to engulf the asbestos fibers, and then they release the cytokines and other chemicals, thus causing inflammation and scarring in your lung tissues. These are some facts about asbestosis that we should know. So asbestosis is a type of interstitial pulmonary fibrosis because it causes scarring in the interstitium of the lungs. And asbestosis starts in the lower lobes and subpleurally. It may or may not accompany pleural effusions. Asbestosis is mostly believed as occupational lung disease, which means you get asbestosis by working in your job which contains handling asbestos. But there are some cases with second-hand exposure to asbestos-containing dust. The risk of asbestos is directly related to the intensity and duration of exposure to asbestos, which means the greater the exposure, the greater the risk of lung damage. Next, let's see what is asbestos. Asbestos is a natural mineral product that's resistant to heat and corrosion, which means it's very useful. So it was very extensively used in the past in insulation, cement, and some floor tiles and in other industries. However, federal government of US began regulating asbestos and asbestos products in 1970s. And also, many other countries have banned the use of asbestos since the 1980s. So most of the people with asbestosis got the disease in their jobs before asbestos is regulated in the 1970s. These are the three main types of asbestos fibers known to cause asbestosis. Exposure to asbestos fibers not only increases the risk of asbestosis, but also increases the risk of other diseases. So these are the four main diseases known to be caused by asbestos: benign pleural plaques, lung cancer, mesothelioma, and asbestosis. Benign pleural plaques are the most common lesion associated with asbestos exposure. They are asymptomatic and they can be seen as calcified plaques on the pleura and on the diaphragm. They also increase the risk of pleural effusion. Asbestos also increases the risk of lung cancer, and if you smoke, it can further increase the risk by 15 or 30 times, so smoking cessation is recommended if you had exposure to asbestos. Mesothelioma is a malignant tumor that arises from the serosal cells that lines the pleura. Lastly, asbestosis is caused by asbestos exposure, and it is a type of diffuse interstitial pulmonary fibrosis because it causes scarring in the interstitium of the lungs. Next, let's see the risk factors. The ones with the highest risk are those who worked in the production, milling, manufacturing, installation, or removal of asbestos products before the late 1970s. So these are the occupations dealing with asbestos, and they include asbestos miners, aircraft and car mechanics, railway workers, and shipyard workers. I think you can remember this easily because these are all transportation methods. And then let's remember it by A, B, C, and E. So asbestos miners and aircraft and blah blah blah, and then boiler operators, construction workers, electricians, mill workers, and workers who remove asbestos insulation around steam pipes in old buildings. Also, smoking increases the risk of asbestos-related complications. We will see the complications in the next page. What are the symptoms of asbestosis? The symptoms initially appear 10 to 40 years after initial exposure to asbestos. Some patients may be asymptomatic, but some shows shortness of breath, dry cough, wheezing, and chest pain. And if the disease is more advanced, you may also see finger clubbing and respiratory failure. This is finger clubbing. So if you look at this, the nails are cuffed downward like a spoon, and they may indicate a disease in the heart or lungs. The complications of asbestosis include non-small cell lung carcinoma, mesothelioma, and also pulmonary hypertension and right heart failure. And if severe, asbestosis can even be fatal. The clinical findings include clubbing of fingers in the physical exam, and hearing fine crackles by stethoscope on auscultation because it's an interstitial disease. As for imaging tests, Chest X-ray is the best initial test, and it may show bilateral pleural thickening with linear opacity and diaphragmatic pleural plaques and infiltrates. CT scan has better sensitivity, and preferably we should take high-resolution CT. And we can see intralobular, small, rounded or branching opacities. And also remember that there will be thickened interlobular septa because of inflammation in the septa, and subpleural curvilinear lines, and parenchymal bands. And in the advanced disease, we can see honeycombing pattern. In the pulmonary function test, we can see the restrictive pattern, and we can see lower DLCO because of the reduced diffusing capacity. The diffusing capacity is low because there is scarring and thickening in the interstitium. The diagnosis of asbestosis is based on the clinical history of exposure to asbestos and imaging tests such as chest X-ray and high-resolution CT, and they only require lung biopsy for confirmation very rarely. Bronchoscopy is more invasive, so bronchoalveolar lavage and lung biopsy are rarely needed. If the patient has pleural effusions, you can also do thoracentesis to remove and analyze the pleural effusion. Now let's see the treatments of asbestosis. There is no treatment that can reverse the damage to the lungs, so we can do supportive treatment to relieve symptoms and prevent complications. Patients need routine follow-ups such as chest X-ray, CT tests, and lung function tests, so that the physician can know the severity of your condition. And also for difficulty breathing, there is supplemental oxygen therapy and also pulmonary rehabilitation. The pulmonary rehabilitation can teach patients breathing and relaxation techniques, and it may help some people. Preventive measures are also recommended for asbestosis patients. They include eliminating the exposure of asbestos and also immunizations. A patient with asbestosis should receive influenza shots every year and pneumonia shots periodically. Smoking cessation is also recommended to reduce the risk of complications. In rare and advanced cases, a doctor may recommend a lung transplant or surgeries. Finally, it is the review time. So what is asbestosis? Asbestosis is an interstitial pulmonary fibrosis caused by prolonged exposure to asbestos fibers, and the symptoms begin after 20 to 40 years. The symptoms include shortness of breath, dry cough, wheezing, and chest pain. And in advanced cases, finger clubbing and respiratory failure. There are also many complications such as lung cancer, mesothelioma, and pulmonary hypertension and right heart failure. Asbestos not only causes asbestosis but also causes benign pleural plaques, lung cancer, and mesothelioma. These are 4 main diseases that we should remember. And most of the patients with asbestosis are those who worked in these kind of industries before the 1970s. The clinical findings include clubbing of fingers, fine crackles on auscultation, and in imaging tests, you can see pleural thickening bilaterally and also diaphragmatic pleural plaques. And if you see these in someone with pulmonary fibrosis, these findings indicate that the fibrosis is caused by the asbestos exposure. And also in pulmonary function tests, you can see restrictive pattern and lower DLCO. There is no definitive treatment for asbestosis, so you can do supportive treatment by doing oxygen therapy and also pulmonary rehabilitation. Routine follow-ups are very important, and also there are preventive measures such as eliminating exposure, and the patients are recommended to do immunizations and also smoking cessation. In the severe cases, there will be lung transplant recommended. Okay, so it is the end of my video, and I will leave a link in the description box where you can download this note spreadsheet. I will try my best to make better and more useful contents in the future, so if you could, it would be very nice if you subscribe to my channel and if you could give a thumbs up to my video. And also please feel free to leave comments. So see you on my next video. Bye!